you're not good enough at ultrasound, that's not an excuse to punish your patients with radiation.
Ultrasound some hearts, some lungs, some IVCs. Let us know how you feel about it.
Well, sitting between both of you guys on the couch right now.
Mike, we never just talk anymore. Seems like it's always business between... So I was thinking, what's your favorite book?
I love the Iliad, Pride and Prejudice, but I gotta say it's Introduction to Bedside Ultrasound by Dawson and Mallon.
Yeah, I could read If You Take a Mouse to the Movies all day long, but Volume 1 of Introduction to Bedside Ultrasound is pretty incredible. What if I told you, though, that Volume 2 is coming out?
I'd say I already knew it since I edited it with you.
Oh, yeah. Well, then you also know that it's absolutely amazing. It's 20 all-new chapters that our authors have hit it out of the park on.
Arnfeld on TEE.
Haney Malamet on right heart.
Lalay and Nagdev on nerve blocks.
Adhikari and Amini on procedures.
Broomdocs on advanced trauma procedures.
Okay, we can't name any more. They're all absolutely amazing. We didn't even mention EMS by Cliff Reed, Admin by Raj, or PEDS by Andy Sloas of the PMED podcast.
MSK by Matt Fields. Med Ed by Bonner and Chris Fox.
Seriously, stop it. We're not going to talk about API, DVT, SBO, cardiac output, diastology, or anything else.
You're right. They just need to trust us. It's amazing.
And more importantly, it's available. Go to iTunes and get it now. Supplies are limited.
They're not really limited.
You don't know that. iTunes could run out at any time, or the site could crash, or a meteor could strike the servers. Hello, everyone. Welcome back to the Ultrasound Podcast. Last episode, we were talking about the future of medical education. And we told you how we think just-in-time learning is really the key in the future. And we give you several examples of things that we do in our own emergency departments to enhance the learning of our residents and medical students. Things like using Introduction to Bedside Ultrasound, the 1 Minute Ultrasound app for the iPhone and iPad, videos that we've created that we put at the bedside on the ultrasound machine so that our learners can learn in real time or right before they perform procedures. The thing is, though, there are a lot of resources out there created by people much smarter than us. So that's what we want to do right now. Mike's going to tell you about some of those resources and actually tell you how he uses this in his practice and give you some recommendations of what you can do to bring your education into the 21st, maybe even the 22nd century.
Thanks, Matt. I think the 22nd century might be stretching it just a little bit, but I do want to go over a few things that I use in my practice on a regular basis, and I think you do too. So the first thing I want to talk about is something very near and dear to mine and Matt's heart, and that's Twitter. Twitter's a phenomenal resource. It's like a news feed for medical education. It's like everything you ever wanted to know about and none of the stuff that you really didn't care about.
To be fair, there probably are a few things on Twitter that you don't really care about. But I'm listening. Go ahead, Mike.
And there's a lot of ways to use Twitter in your practice, but the one that I really want to talk about is for at the bedside learning. So to discuss that, I want to talk about a case that I had just a couple of months ago where Twitter was important. So this is a case of a 37-year-old guy that was transferred from an outside hospital. He was diagnosed at that outside hospital with heart failure. He was hypoxic there to the 70s, intubated at that hospital, and then transferred to me. His vital signs were, heart rate was a little fast, 112, temperature was pretty normal, 37.1, blood pressure also pretty normal. So at that outside hospital, he was started on a nitroglycerin drip, and as I mentioned, he was intubated for respiratory failure. So he gets to me, and we do the thing that we always do whenever a patient comes in intubated. We get a chest x-ray. And I took a quick look at this chest x-ray at the bedside, and he had some puffy infiltrates bilaterally, which seemed pretty consistent with pulmonary edema to me. And my radiologist read it, and they said severe bilateral central airspace pattern, which can represent pulmonary edema. So I had no real reason to believe anything other than this guy had heart failure with pulmonary edema. Now, he was kind of young, so it was a little strange. But for the most part, that's what it looked like. So I go ahead and start my physical exam, and to do that, I obviously picked up the cardiac probe, and this is what I saw. Heart that is actually functioning pretty well. So you can see here the mitral valves touching the septum. The squeeze is pretty good. Doesn't look big, doesn't look dilated. This doesn't really look like the heart of somebody who's in heart failure. So I was a little confused, and I put the probe on the IVC. And this is what I see here. IVC is collapsing, doesn't look like he's volume overloaded. So you can imagine I was a little perplexed. I didn't really know what I was dealing with here. So I do what I always do when I don't know what's going on. I ultrasound the patient a little bit more. So I took the probe and looked at his lungs here, and I saw some weird stuff, and I didn't really know what I was looking at the time. And here we see some sort of normal lung with these areas of what I now know is called a subpleural consolidation with some trailing confluid B lines. It's not really a pattern I was familiar with at the time. So I'm sort of standing there in the trauma bay, scratching my head a little bit, trying to figure out what's going on with this patient that was originally presented to me as pulmonary edema, but I'm starting to get some information that maybe that's not what's going on. So then I remember this tweet. Just a couple days before, I'd read a tweet by Mike Stone, and he basically tweeted this algorithm of bronchiolitis versus viral pneumonia. It was a paper by Jim Sung that had been published just a few days before he actually tweeted it. And I remember reading through the tweet and reading the abstract and just getting a quick blurb about it. But when I remembered that tweet, I basically pulled it up on my phone at the bedside in the trauma bay, and I read through the abstract real quick, pulled up the paper, read just a few parts of the paper, looked at some of the pictures, and realized that this was maybe pertinent to the patient that I was taking care of at that very moment. So I went over to my computer and pulled up a quick Google search on subpleural consolidations, came up with several blog posts, one of them from the Mount Sinai Ultrasound blog. That was actually a post written by Jim Sung himself, and basically ended up diagnosing this patient with a viral pneumonia and a bacterial pneumonia on top of it. So we started the patient on antibiotics. I stopped his nitro drip and got a flu swab, admitted the patient to the ICU, and he came back flu positive the next day. This is a case, I think, for me at least, that demonstrates how Twitter improved my patient care. Without Twitter, there's no way I would have known about this study. I don't keep up with the journals that quickly. I'm not, I don't read them the day that they come out. So I wouldn't have even probably heard about it if I hadn't read that tweet by Mike Stone. It's because of Mike Stone, Twitter, and Jim Sung that this patient is alive today. That's not true. The guy would have been fine anyway. But he still got better care because of Twitter itself. There's this amazing thing going on Twitter right now called FOMED. FOMED stands for Free and Open Access Medical Education, and people put a hashtag in front of it, and if you're not familiar with Twitter, that means that it's sort of like a category, so you can search by hashtags. So if one day you ever join Twitter and you decide, you know what, I want to know everything about free and open access medical education, well, you better have some free time, but what you could do is you could search hashtag FOAMED, FOMED, and that would basically give you every tweet that anyone has ever tweeted whenever they felt material was worthwhile to spread to everyone else in the Twitter universe regarding free and open access medical education. Twitter's great because it filters all of the information out there. There's that old adage that it's sort of like drinking from a fire hose, and that's kind of what medical education's like online now. There's so much of it out there. I mean, there's EM Crit, ER Cast, EM Rap, all of these amazing blogs, all of these amazing podcasts. By the time you get done reading all of them and listening to all of them, there's no free time left in your life, right? So you can't do everything. Twitter's awesome because it kind of filters all of that information.
Now, Twitter can definitely seem like a fire hose as well, but the fact that you're limited to a certain amount of characters really focuses people, and you really get a sense of what people are talking about and what are the main salient points. And if you get good with hashtags and know who to follow as well, that can be another great way to filter medical information
For you. That's right. Twitter's kind of like taking a big, stinky, smelly pile of medical education material, filtering it through crowdsourcing, and then dripping out these little bits of genius that turn you into a medical god. But there's other stuff out there too, and Twitter's great, but it's not the only thing, and there's plenty of material out there on the internet that you can also use for more specific education. Let's take, for example, Jeff Hayden's site. Jeff has a pretty amazing site called Emergency Ultrasound Teaching, and on his site he's got lectures, he's got cases, galleries. Matt and I actually both use his site for our medical students, and we have our medical students review his lectures, his online narrated lectures, as part of our curriculum for our medical students. Really an amazing resource. There's also Beatrice Hoffman, who developed SonoGuide, which is a phenomenal online resource with some amazing authors, pretty much the leaders in emergency and bedside ultrasound, who've developed these different chapters for SonoGuide. Vimeo is another great resource, and one of the reasons Vimeo is so good is because it's multimedia, which makes it perfect for emergency ultrasound. Ultrasound's a sort of a unique medium because it requires video, so it makes it harder for some things like blog posts, things that don't have multimedia or video capabilities, and that's why Vimeo is so good. For example, AEUS now has their narrated lecture series on Vimeo. You can check out any one of these amazing lectures on Vimeo, and they're sort of nice because they're all a standardized format, so you know exactly what you're going to get. And then there's Mike Stone, who's got his Vimeo channel. It's 35 videos, any of them range from 2 minutes to 60 minutes in length. He's got videos on nerve blocks, and I think some more videos on nerve blocks, and he's got another one on nerve blocks. Yeah.
Well, that's not fair, Mike. I have to defend Mike Stone. He also has a few on multimodal pain control, focusing on depositing local anesthetic around nerves as well.
Thanks, Matt. I appreciate that. And not only just Mike Stone, but there's also the Ultrasound in Emergency Medicine and Critical Care channel, which is awesome because it has all of these different videos put up by multiple different people so that you can share normals, share abnormals, and really get a sense of what's out there and what sort of different findings you can have on ultrasound. There's also lots of blogs out there, and we should probably mention some of those. One of the most prolific bloggers out there is Lale. Lale's blog, Sonospot, is one of the best blogs out there. Absolutely. She's got tutorials, Sono cases, Sono links. I feel like she's blogging every 45 minutes. I mean, the woman is unstoppable. I think I should also mention the Life in the Fast Lane guys. And these are some Australians, so don't hold it against them, but they really honestly have their hands in just about everything online medical education. They run the Life in the Fast Lane, which is sort of like this blog for curators of online medical education. Mike Cadogan's one of these guys, and he actually recently started this thing called Global Medical Education Project. GMEP is one of those things that's kind of like Dungeons & Dragons meets Facebook meets medical education. And seriously, it's actually pretty awesome. You can sign up for it, put a picture of your face on your profile, request to be friends with people. You can answer questions, upload media. It's really, really pretty cool stuff. You should check it out.
The other guy is Chris Nickson, but actually I think it's pronounced Cadogan.
No, I'm pretty sure it's Cadogan.
Cadogan?
Cadogan.
At Sand and Surf and at Precordial Thump.
These guys are geniuses. Anything they do is pure gold. All right, there's also Michelle Lynn. Can't forget about Michelle. Now, she doesn't just do ultrasound stuff. She does a little bit everything emergency medicine, but quite often she does throw in some ultrasound there. Her blog, Academic Life in Emergency Medicine, is definitely one of the best blogs out there. I know it's one of the most popular, and you should definitely check it out if you haven't looked at it before. There's lots of other blogs too, though. I don't want to forget Mount Sinai Emergency Medicine Ultrasound blog or Dr. Bonner's Ohio State Ultrasound Education blog.
And at Broomdoc, because he's actually a pretty phenomenal ultrasound guy. He knows a little bit of everything, so people don't think of him necessarily as just ultrasound, but he's really good. He did a phenomenal job writing our advanced trauma chapter in Introduction Best Ultrasound Volume 2. I don't think we've mentioned that's out.
No, Matt, we hadn't mentioned that. All right, so there's also lots of other podcasts that we should mention. One of the best, I think, out there is Chris Fox's iTunes U. So he's actually put his entire medical student curriculum on iTunes U so that it's completely free, downloadable. You can watch it anytime. These are all narrated lectures. This is perfect if you're trying to set up a medical curriculum for your medical students, or if you're trying to get some material for your residents. Awesome stuff and totally free, which is great. There's also the Sonocave guys, which have started doing a little bit of podcasting here and there. These are also some other Australians with some ultrasound interest. And then, of course, Matt and I have the Ultrasound podcast, which is another one out there for ultrasound specifics. So I think the important thing to remember, there's lots of material out there, and what people like to use the most is really up to them, right? Because we all have different ways that we like to learn. But the important thing that we really want to get across is that you have to put the material in the hands of the students at the time when they're most vulnerable to creating new memories. And I think, and Matt and I both, that is at the patient's bedside, right outside the patient's room, right after you've taken care of a patient, because that's when your adrenaline's flowing. That's when you're really fresh and ready to remember things. So whether you put a iPad on your ultrasound machine, whether you load material on an iPhone, whether you make them carry around 15 books in a book bag, whatever it takes, you need to have the material there for them. And not only that, you need to be there for them as educators when they're most vulnerable. These are the things that I think really matter as far as advancing medical education.
So what do you do with all this? Basically, there's an incredible amount of foamy goodness out there. How are you going to take this back and create these micro-learning environments for your students and residents? Well, we'd like to give you a couple of take-home points, things that you can do immediately. So here's a very simple one. On your ultrasound rotations for your residents and medical students, on their syllabus where you have their goals and objectives, place links there to these things, emergency ultrasound teaching, to different podcasts and different resources for them, all kinds of different multimedia for them to actually learn with, not just reading the textbook like we've done in the past. Obviously, I think it would be even better if you were to take an iPad and put it on your ultrasound machine and load up these resources for your students, or give them an iPad mini if you've got the resources to do that with this material loaded on it. But at the very minimum, you can place links in their learning material. This is for the educator, though. What about the learner out there? What do you do? Where do you go from here? Well, there are plenty of times in life where it's okay to settle. You know, I had to convince my wife of this several years ago. It's all right to settle sometimes. But when it comes to your education, this is kind of your shot. You've got a few years of dedicated time where you really got to get this. Your patients are counting on you getting this information and getting it optimally, learning this as well as you can. So whatever you do, don't settle. Demand this of your educators, that they give you this type of learning, this just-in-time learning, and create the right environment for you to be able to effectively learn. I already know that you're extremely capable of this. Recently I had a medical student tell me a story about doing a rotation in a rural area. It was actually a little island off the coast of Canada. And it was a really small place that had an ultrasound machine but no CT scanner, and they had a really sick patient that came in. She was a young lady. They were worried about a possible ruptured ectopic pregnancy because she looked kind of pale, had some belly pain, and she was the right age for that. However, like I said, no CT scanner, no advanced imaging, just the ultrasound machine, and the attending that was on didn't know how to use the ultrasound machine. The medical student didn't really know how to do a fast scan, but he had heard about it and he knew it may be useful here. So he actually showed the attending the 1-minute ultrasound app. They watched how to do a fast scan. This was this attending's first scan ever, and they compared the right upper quadrant view of this patient with the right upper quadrant positive view in the app, and they called transport based on this. The medical student told me that the beta HCG came back positive about the time they were transporting the patient off, and she was getting quite a bit sicker at that time as well. And they really think that if there had been a delay, if they hadn't have been able to do this in real time, this real-time learning, that she wouldn't have done nearly as well. So this generation is perfectly suited to do amazing things when you give them the opportunity to take advantage of technology and this free education. But here's the thing, I don't think you can just consume this. I actually think you all are also perfectly suited to create this as well. So if no one in your university or your residency is giving you the information and creating this type of environment for you, just do it yourself. Don't take no for an answer. Create it for yourself and for others. You digital natives are perfectly suited to create this content. My 1-year-old daughter actually made this presentation.
Yeah, and don't get shown up by Matt's daughter.
Seriously, the effort is worth it. Your education and your patients deserve it. If you're not good enough at ultrasound, that's not an excuse to punish your patients with radiation.
Ultrasound some hearts, some lungs, some IVCs. Let us know how you feel about it.
Well, sitting between both of you guys on the couch right now,